for HealthyPlace, and I also write the Breaking Bipolar blog at HealthyPlace, and I write the Bipolar Burble blog at my own personal site. Today, our show is entitled Bipolar Mania Caused Serious Problems in My Life. And I'll be introducing our guest in just a minute. Then I'm going to do a short interview with her, and we'll open up the floor to your personal questions. As we go along, please feel free to comment in the text box, and we will post those on the screen. To make sure everyone understands the term mania, I just want to take 1 minute and explain it. So, we're going to be talking about the manic phase of bipolar disorder. And this can produce extreme energy, extreme bouts of euphoria, great excitement, delusions, and overactivity. It is a very extreme state of almost a high. We'll be posting a link in the chat box for more information on HealthyPlace for everything you'd like to know about mania. We're also going to be bringing on a psychiatrist, Dr. Prakash Mishra, and he's going to talk more about the treatment of bipolar mania. And he's going to be on in about 15-20 minutes. Our first guest today is Katie Spence. So Katie is 34 years old now, but her battle with mental illness began when she was only 12. She was in and out of psychiatric hospitals and trying different medications for the next decade. Insurance didn't cover the expenses, and her parents spent a fortune trying to keep her alive. Welcome, Katie.
Hi, hello. How are
Hey.
you?
I'm doing really well. How are you?
I'm wonderful. Thank you for having me.
So, thank you for joining us today and agreeing to tell your story. So, since we're focusing on mania, and as
Mhm.
a preteen, you experienced mania, what kind of symptoms did you experience at that time? What did that feel like for you?
For me, there was intense energy. Of course, there was the inability to sleep, but when I could be trying to go to sleep, I would have to do things such as go on jogs in the middle of the night, so anything to try to wear down my energy. I talked so fast that I slurred to the point where people thought I was on illicit substances, but I couldn't stop. I couldn't stop talking, and I was just an energizer bunny, just going, 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 going. I'd go weeks without sleep. It messed with my schoolwork, my personal life, messed with driving. There was really not much that I could do when I was in mania.
So, when you went weeks without sleep, does that act like how many hours a night would that be without you sleeping? Like, or would you get any sleep at night? I guess is my question.
Sometimes the meds would work to where I could get naps in, and they were
Okay.
really just that naps. But the sleeping meds didn't really do much for mania at that time in my life. All they really did was make me hallucinate, and it was just staying awake and hallucinating now, thanks to the sleep meds, unfortunately.
So you said that it caused problems basically in all areas of your life when you were even very young. So do you want to give us a couple of examples of what that looked like for you?
Absolutely. So for me, starting off at age 12, it was definitely getting in trouble in school. There was the hyperactivity and impulse control that I had issues with. So when it came to don't do this, don't do that, my impulses would drive me to do this or do that or exactly what I was told not to do. So there was definitely school problems. Home life, there were problems. Bless my parents' heart, they put up with a lot for me.
Mm.
You know, when it comes to bipolar disorder and especially mania, those impulses control you. So there was lots of things there, and there was even run-ins with the law.
Oh my goodness. Okay. So I'm thinking of your parents. You just mentioned them, and it seems like it would be so much for your parents to deal with. What was going on with you for your healthcare and then also paying for your healthcare. So how did your parents actually handle that?
They actually, at one point, both my parents worked two jobs. They are amazing people who gave everything they could to see me get better. And at that point, mental health care wasn't covered. And so a lot of it was out of pocket expenses. And they got to a point where they both had to work two jobs just to make ends meet so that I could get the care that I needed and get better.
That is so difficult. I mean, just so tough on a family. Tough for you, tough for them. Do you have siblings?
Yes, I'm the fourth out of five.
4 out of 5. Okay. So you were affecting not just yourself and your parents, but a whole family dynamic.
Exactly. Yes, it affected everything.
So, as you got into your 20s, did you find that mania started affecting you differently?
Yes, it did. So as I became older and a little bit more mature, the hallucinations got a little worse, and then I just began acting out. I was in a lot of physical altercations. I began drinking heavily, and so there were run-ins with the law when it came to drinking and physical altercations. There were problems in my personal relationships because when I'm in mania, I'm very euphoric and I love you so much. And then as
Mhm.
soon as the mania would subside, I didn't like you all that much. And it just kept adding more and more when it comes to personal relationships and legal problems.
So, you said that one of the interesting things that I think you said there was, I love you so much, and then I didn't like you so much, right? Does that
Exactly.
mean that you would get into and out of relationships quite frequently then?
Very, very frequently. And then as soon as I got in the relationship, they were the best person in the whole wide world and I loved them and I was going to be with them forever. And as soon as mania subsided, we were done.
So, I just want to let you know that Emily says that she can relate to you so much, and she wants to thank you for sharing your story.
Aw, thank you, Emily. Glad to be here.
Also, when you were 12, it's really tough, as we know, to diagnose bipolar disorder in children. Now, it sounds like you had a pretty extreme case of mania, so maybe that made it a bit easier. I don't know. But how were you diagnosed at such a young age?
Actually, at first, when my parents first took me to the doctor, I was told it was just hormones coming in and needed to just get over it and roll with the punches. And nobody else acted the way I did when it came to hormones. But it got to the point where suicidal ideation and self-harm set in, and at that point, it was, "Okay, this is more than hormones, and we need to do something with this." And I went through a ton of different counselors and psychiatrists. I even had a psychiatrist hospitalize me only to tell me they're not gonna be my psychiatrist anymore and leave me stranded in the hospital. And then got a new one who said, "Oh, you're not bipolar, you're depressed." And then it just kept going and different, different, different. And my diagnosis changed every time I got a new psychiatrist. And the one thing that always stayed constant with every psychiatrist was bipolar kept coming back.
Okay, so from the time that you started experiencing symptoms until the time you got that bipolar disorder diagnosis, how long was that?
About a year and a half.
About a year and a half. Okay. So a lot of people say that they enjoy the manic phase. Is this something that you would identify with?
I definitely prefer mania over depressive episodes. I feel the depressive episodes are the ones that are a lot more dangerous when it comes to my safety. Mania I love because I can multitask like a pro. I can conquer the world. I can take over everything, start a new company, and just be great at everything and just never stop and have all the time in the world. And then the depressive side hits and I can't keep up with myself.
So, when you do have that mania and you are like multitasking and you're doing all these amazing things, when you come out of it, do you find that you did those things well, or did you just think that you did them really well because you were manic at the time?
I call it hot mess. That's what we call it in the South. I was a hot mess. I was 20 different directions, giving a little bit of me every little place that I could go, but nothing really was as great as I thought I was being for sure.
Right. Okay. And do you have a different opinion now of mania than you did, say, when you were in your 20s?
Yeah, now I respect the illness and I understand the dangers that it imposes on me, and I try my best to stay away from that as much as possible, especially speeding
Yeah.
tickets.
Oh, well, that's a good one to stay away from for sure. I like to think of staying away from speeding rather than just the tickets, but I but I hear you.
Yeah, well, the tickets just make it worse.
Yes, totally. Okay. So David is asking about specific manic problems and specifically substance abuse. Do you want to talk a little bit more about what happened with you in substance abuse?
Yes. So substances became my go-to, especially in mania. People were really scared of me. You get that look, oh, you're bipolar. And so to calm myself down, I started using pain pills and then sometimes alcohol as well as a depressant, just so, and it became an addiction because I thought that I couldn't function and people wouldn't like me if I didn't take these substances. So it became a big problem in my life.
So, substance abuse is very common with bipolar disorder, as many people know. Did you have to go through some treatment for substance abuse specifically?
Yes, my dad drove me himself.
Okay, so you went to a facility then.
Yes, more than once. I had to go for substance abuse specifically. I went a total of 2 times. The other times they were mental health crisis related.
Okay. Joanne would like to say, super proud of you, Katie. You continue to push through obstacles. So I just wanted to pass that along.
Oh, thank you.
So you're now a married mom. So you have two
Yes.
kids. You've been through a whole heck of a lot. What is the most helpful thing that you've learned when it comes to dealing with bipolar mania?
To forgive yourself. And just start every day. Know that you can't change what happened yesterday. And as long as you wake up every day and you strive to be better than you were yesterday, then you're on the right track. And that is the best thing that you could do for yourself. Never give up.
That's an amazing piece of advice. Thank you so much. I just want to say to the audience, if you do have any questions, now is an excellent time to ask them. We've been asking a few throughout, but we're going to keep doing that. And we're going to do that also with Dr. Prakash Mishra in just a few minutes. So we do have another question, and that is, do your children notice your mania?
Yes, they call it super mom. Mom can go to the park, mom can play all the games, mom can do all the fun stuff and get everything done. So they like mama's mania face.
So you do still experience mania to this day then?
I actually recently experienced it due to COVID. I have a very meticulous schedule, and that's what keeps me going. And my
Mhm.
schedule got messed up, and because of that, I missed quite a bit of medication unknowingly, and it sent me into mania during COVID. So they got to see that again. My house was perfectly spotless. The kids were having a ton of fun, and we were just rolling through it. I was too afraid to go to the hospital because I didn't want to catch COVID. So I wrote it out at home, which I don't recommend to the viewers. But due to COVID, I chose to stay at home.
I see. Okay. So Danny says, I live with bipolar 1 and I can definitely relate to you, Katie. Thank you for sharing your story. So just another piece of, and I know that there are so many viewers out there right now who want to say thank you because not enough people are talking about mania sometimes. It's almost overlooked because depression, of course, and bipolar is so ubiquitous.
Yes,
Sometimes there's not enough talk about mania. So thank you so much for being so open. So
absolutely.
Mindy asks, is bipolar mania causing problems in your marriage and how do you deal with it?
Yes, it does. Fun fact, my husband is also bipolar. So
Oh
we
my
both
goodness.
experience we both experience mania, and it causes problems for both of us. Usually because when one of us is in mania, the other one's in a depressive episode or stable. And so it interrupts the other person's sleep, it interrupts the moods, and how we interact with each other. We try to be understanding and loving of each other, but sometimes we're still human and go, this is enough. So yes, it does cause problems for on both sides.
Wow, that's incredible. And so is there a particular coping technique that you like to use when, you're having that trouble at home?
Yes. So I believe in just being an open, honest book and saying, I'm not okay. And I let my husband know, hey, I'm not okay. This is where I'm at. I'm in mania. And he goes, oh, thanks for the heads up. And we just kind of write it out together. And he says, he'll stay on me when I tell him, hey, I'm in mania. He'll stay on me. Did you take your medication? Have you checked in with your psychiatrist? And we do that for each other. We can be each other's point person and just say, have you done what you need to do? Where are you at today? Do we need to go to the hospital? and and it works great. I mean, he's had to put me in check a couple times, but
That sounds like a beautiful relationship and push pull, like way to get through that together. So another question from Nova, and Nova says, "Thank you for being an inspiration to those of us who struggle." So that's
thank
great.
you.
And
Yeah.
also says, "Thank you for your advice to start each day new. I will try my best." So that's a beautiful note.
Yes. Forgive
Um,
yourself every day.
I think that's Really powerful. Thank you. And then Stan says, has mania caused sexual problems for you? If so, what were they and how did you deal with them?
Well, yes, I mean, that's just part of mania. When it comes to hypersexuality, it can go one of two ways. I mean, it can be beneficial to the relationship, but also in my younger days, it led to the sexual promiscuity, which was not a good thing. And so it can go both ways. It can be beneficial, it could also be detrimental. I know that I have had friends who are bipolar that it caused them to step out on their relationships. And at that point, you've got to be as self aware as you can be with your illness and recognize where you are and take whatever necessary steps you can to protect yourself. So, for instance, if you know that you have a habit of stepping out on your relationship, that's the time to buckle down and give your partner the heads up of what's going on so they can actually help you stay away from those temptations.
So Liz says, how often in the last 5 years have you had to go to the hospital to deal with mania, and what was that like?
I have not had to go to the hospital in the last 5 years for mania, and I am very proud of that.
That's amazing. Thank you so much. So, when you did actually have to go, what was it like for you?
I actually always enjoyed it. I felt safe there. I felt safe from myself. I felt safe from outsiders' opinions of what I should and should not be doing. It was always a safe place for me where I could deal with what I needed to deal with in a judgment free zone.
Beautiful. Well, I'd like to end the interview on that really positive note because I'd like to suggest that mania is treatable, and we are going to learn more about mania treatment from Dr. Prakash Mishra. But before we do that, I just want to say thank you so much for joining us.
Absolutely.
It's You have a lovely way of advocating for mental health and for talking about your struggles. You're very brave.
Thank you. Thank you for having me.
So we have lots more information for you on bipolar mania on the healthyplace.com website, and I do hope that you will check that out. I know that Katie's story has helped a lot of people, and I know that something else might help people is learning a little bit more about bipolar mania treatment. So our next guest is Dr. Prakash Masand. And Dr. Masand is a board certified psychiatrist and CEO of Global Medical Education. And this provides psychiatric education to doctors and medical professionals around the world. Good to have you. Hello.
So good to see you, Natasha. Pleasure to be with you and your viewers.
Thank you, Dr. Masand. So, can you tell me a little bit about how you actually recognize and diagnose mania, bipolar mania?
Sure. So, as Katie was pointing out, there often is a missing of the diagnosis of mania if one does not specifically ask the questions for mania. So, the increased, excessive, elevated mood, the irritability, the distractibility, the increased talkativeness and racing thoughts, uh, increased involvement in regular activities, or involvement in activities that have a potential for painful consequences, like Katie said, drinking, substance abuse, promiscuity, and then decreased need for sleep. So a lot of patients will say, I don't need 7 hours of sleep. I can do with 2 or 3 hours of sleep. That's all that I need. And then you can also have grandiosity and excessive spending sprees, running up a credit card tab, running into debt. So those are some of the signs and symptoms of mania. And it's very important to ask about each of these in every person who experiences depressive symptoms. Otherwise, the diagnosis can be missed of a bipolar disorder.
So, yes, because Katie was saying she didn't have a consistent disorder initially, right? And it definitely could be because some of the questions weren't being asked, like you said. That's so critical. Why is it that so many people who experience mania get into various sorts of trouble in their lives, whether it's like overspending, drug and alcohol use, sexual acts? Why is that?
So, for two reasons. One is mania is characterized by impulsivity and lack of control And so that can often lead to a lot of problems. We talk about in psychiatry the superego. We don't have that superego in mania. And so the id takes over and you do things that you ordinarily would not do. The other reason is that it's often not considered by the patient to be a problem. So we have a fancy term in psychiatry which says mania is egosyntonic. It bothers everybody around the patient. It bothers the family. It bothers their colleagues, their workers, their boss. But the patient themselves says, what's the problem? I don't have any problem. It doesn't bother me. So that's the other reason why it can lead to behaviors that can be detrimental.
So what's that term again?
It's egosyntonic. So
egosyntonic. Okay.
syntonic. It's syntonic with the ego, and the contrast to that is ego dystonic. So bipolar depression is ego dystonic. It bothers the patient. You hate the depression. Nobody wants to have depression. No bipolar patient wants to have depression. They
Right.
always come into treatment for the depression, never come into the treatment for mania.
Right. Well, thank you for teaching me that. That's a new term for me. So, because of your business, you are in touch with leading treatment experts and psychiatric researchers in the US. So, today, what is the best treatment for bipolar mania and how effective is it?
So it really depends upon the symptoms, the history, past response or non-response to treatment. And that's what often determines what you'll try first. So there are two major classes of medicines that we choose from. One are what we call the antipsychotics, the atypical antipsychotics, medicines like risperidone, quetiapine, olanzapine, aripiprazole, lurasidone. And then the other is what we would traditionally refer to as the mood stabilizers, even though the antipsychotics are mood stabilizers, but drugs like lithium, like sodium valproate, Depakote, carbamazepine, Tegretol. So there are two classes of medicines that we commonly will pick from, but very often we'll often combine the two acutely because often that's much more helpful than using either one alone in some patients with mania.
So, the person might have something like an antipsychotic and a mood stabilizer applied together during that really acute phase of mania when they're really out of control.
Correct. And then often we may also use a benzodiazepine as an adjunct, particularly if there is marked sleep problems, because we know sleep really can disrupt the circadian rhythms of mood and can precipitate mania, hypomania, and can prevent the mania from responding to medicine. So you have to normalize the sleep-wake cycle quickly. And very often we may use a sedating benzodiazepine like clonazepam, Klonopin, to treat the sleep disturbance in conjunction with the antipsychotic and the mood stabilizer like sodium valproate or Depakote. So very often some patients may be on 3 medicines on day one, particularly on the inpatient psychiatric unit. But even in the outpatient setting, if you want to prevent a hospitalization, you may need to be very aggressive to do that.
So I just want to mention, Ellie says that her doctor initially misdiagnosed her with depression, which is what we were talking about, and it's so common. And that's because she didn't talk about the mania symptoms because, as you said, she didn't think it was a problem. So exactly what you said. So then Kevin says that Kevin can't afford to go to a psychiatrist. So the family doctor takes care of Kevin. But mania is a big problem. What should Kevin do?
So a couple of things. One is maybe Kevin can get a one-time consultation with a psychiatrist at a community mental health center or someplace that may accept his insurance so that the psychiatrist can come up with a treatment plan for Kevin, which can be shared with the family physician. And the family physician is then given specific recommendations on how to treat Kevin's mania. And very often we'll do that. We'll say, try this first. If this doesn't work, try this next. If this doesn't work, try this third. So that's another way to approach it, is rather than seeing the psychiatrist as the primary caregiver, the primary clinician, the family physician can work in partnership with the psychiatrist who does a one-time consultation and then gives recommendations to the family physician.
Great. And you said that sometimes there are community places where you can get that type of help for a lesser cost. Is that right?
That's correct. So they're often referred to as community mental health centers or community mental health clinics. And in each community, you can look it up. You can just go to Google and type in CMHC, Community Mental Health Center near me, and it'll find one close to you. And then you can make an appointment. And most of these will see you even if you don't have insurance. And they also will accept certain insurance like Medicaid, for example, that may not be accepted by many psychiatrists in the private practice setting. So that's another option that you have, is to see somebody in a CMHC.
And that's a really great tip for sure. I do want to mention that SAMHSA also has a treatment services locator on their website. And so that will give you a broad look at the treatment services that are available in your area. And so you may be able to find something relevant to you on a sliding scale, for example, that you may be able to find using that treatment locator. And we will put a link to that in this box once things are done.
Yeah. And Natasha, SAMHSA is a really wonderful resource, not just for finding a clinician, but also getting some very useful tips about the illness, some of the treatments that we are talking about. Patients should definitely have that bookmarked, the SAMHSA website bookmarked, to look at all this.
Great. Thank you. So Sissy now says, I can't deal with my husband when he's manic. What suggestions do you have? He won't listen and he gets very agitated.
And that's always tough because, you have a very connected relationship with your husband. So it's difficult to speak to him as a third person or as a disinterested observer. So I think what's very, very important is to get somebody else who your husband respects and listens to, maybe be that person who points out some of the behaviors that may need more aggressive treatment. So whether they need to touch base with their therapist or touch base with their psychiatrist or their family physician to see, what's going on. Are they skipping their medicines? Are the medicines not working? Do they need an adjustment? Because relapses and recurrences are very common in patients. So you may be doing wonderfully well for months or even a year, and then suddenly the illness rears its ugly head. And this could be even if you're taking the medicines as prescribed. But very often the most common reason for relapse or recurrence is forgetting to take your medicine for a wide variety of reasons, abusing substances, or having a disruption in your sleep cycle. That can be a very important trigger for mania.
Okay. And so you're saying that maybe a third party, maybe someone that they really respect, might be able to better give that message.
Yeah. And there's always somebody in the family who the other person values, respects, and maybe that person can be kind of the bearer of bad news, if one were to say.
Yes. Okay. Thank you so much for answering these questions and for giving us such great tips. I do need to wrap it up now, but Dr. Prakash Mishra, thank you so much for joining us.
So good to be with you, Natasha, and your viewers, and good luck to all your viewers.
So that information was great. I'd like to thank everyone in the audience for participating. We will be back in 2 weeks with another Facebook Live show. Watch for that topic on the HealthyPlace Facebook page. And don't forget to check out HealthyPlace.com for more bipolar mania information. Goodbye for now, folks.